Hello all, welcome back to the Nursing Genre YouTube channel. In this video, I'm going to discuss about the condition called hypertension. Definition: hypertension, also known as high blood pressure, is a condition where the pressure in your blood vessels is too high. That means we call hypertension when a person have 140 by 90 mmHg or higher blood pressure. The World Health Organization also defines the hypertension as the same, that the blood pressure of 140 by 90 mmHg is considered as hypertension. What causes hypertension? Unhealthy eating patterns, that means including a diet high in sodium, lack of physical activity, high consumption of beverages containing alcohol. Common causes of secondary hypertension include, that means certain medications including immunosuppressants, NSAIDs, oral contraceptive pills, kidney diseases, obstructive sleep apnea, primary aldosteronism called Cone syndrome, using recreational drugs, that means amphetamines and cocaine, and people having renal or renal vascular diseases. Those are conditions that affect blood flow in the kidneys, arteries, and veins. Renal artery stenosis is the example, and tobacco use. These are the reasons for hypertension. Who are at risk of getting the hypertension? Having biological family members with high blood pressure, cardiovascular diseases, or diabetes, being over age 55 and being black, having certain medical conditions including chronic kidney disease, metabolic syndrome, obstructive sleep apnea or thyroid diseases, having overweight or obesity, not getting enough exercise, eating foods high in sodium, smoking or using tobacco products, drinking too much alcohol. These are the risk factors. Now, let's see the types or categories of hypertension. Here we can see 120 as systolic pressure and 80 as diastolic pressure. Here we call it as normal blood pressure. When it comes to here pre-hypertension, we can see systolic pressure is in between 120 to 130 and diastolic is less than 80. In hypertension, we can see systolic pressure is in between 130 to 139 and diastolic or the resting phase is in between 80 to 89 up to 90. In stage 1 hypertension, we can see the systolic pressure 140 or higher and diastolic 90 or higher. In stage 2 hypertension, which is severe condition, we can see the systolic blood pressure as 180 or higher and diastolic as 120 or higher. What are the clinical features will be shown by the persons with hypertension? They may experience some severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythms. How can we manage hypertension? Here there are some medications to treat hypertension. Medicines used to treat high blood pressure include diuretics, angiotensin converting enzyme inhibitors, angiotensin 2 receptor blockers, calcium channel blockers, alpha or beta blockers, renin inhibitors, aldosterone antagonists, beta blockers, vasodilators, and etc. In here we saw different kinds of medications that must be prescribed by the doctor. If you want to use, you have to get prescription from the doctor. This picture also shows the clinical features of hypertension, where a person with hypertension feels fainting or may experience fainting. Suddenly they may experience low blood pressure, they may be fatigued, or they may feel nausea, or they vomit, or they feel irregular heartbeats, and they may experience dizziness also. Now let's see the complications of hypertension. Untreated hypertension may lead to serious health problems including coronary artery disease, stroke, heart attack, peripheral artery disease, kidney disease and kidney failure, complications during pregnancy, eye damage, vascular dementia, these and all we can see. How can we prevent hypertension? We have to do actual things to prevent this. That means, number one, keep a weight that is healthy for you and eat a healthy diet. An example is the DASH diet. This is a way of eating that's full of fruits, vegetables, whole grains, and low fat dairy. And you have to cut down on salt. Ideally, we have to limit the sodium intake to 1500 milligrams per day, and we have to get enough potassium in our diet. We have to consume up to 5000 milligrams per day. Some foods high in potassium, that includes bananas, avocados, and potatoes with skin. And we have to do exercise, and to be we have to be physically active, and we should limit alcohol. So these are all the things we have to do to prevent or to keep hypertension away from you. So far we have discussed about the definition and causes, risk factors, types or categories of hypertension, clinical features of hypertension, how can we manage hypertension and how can we prevent hypertension, and the complications of hypertension. Thanks for watching this video. Do like, share and subscribe to this channel, The Nursing Genre, and also follow other content in our channel.